My name is Dr. Jose Mena, and I am with my colleague, Dr. Gosha Krusovanik, orthopedic spine surgeon. And we'll be discussing today about disc replacements, candidates, indications, and some other interesting topics that perhaps a lot of you would like to hear. So, doctor, I see a lot of time in my practice patients that they do suffer from discogenic pain. They have tried all possible conservative ways, including spinal injections. From your point of view, what would be a suitable candidate that you will say, yes, this is a patient that will require spine surgery, and if they have discogenic pain or strictly discogenic pain, what type of surgery will you offer these patients and why?
Dr. Mena, I need two things in order to justify talking to a patient about surgery. The first is I need a story of true attempt at good conservative care. So when I hear that a patient comes from your office, I know that the injections were really high quality injections. And then I feel justified that conservative care has been met, the patient is still suffering theoretically, and in that case, it's reasonable to discuss surgery. The second thing is I need the patient to say that they cannot live with this pain. And if the patient is truly in that much suffering, then it's reasonable to consider surgery. It's reasonable to look at the objective risks of that particular operation, and then to see if the risks are truly outweighed by the benefits. With discogenic pain, historically, we were really limited in what we could do, because discogenic pain, if that's the diagnosis, implies that this is not deformity, this is not trauma, this isn't something that's urgent. This is a chronic, annoying, terrible back pain that ruins their quality of life. But not everyone with discogenic back pain has something to decompress. So historically, it was either a decompression or a fusion. And for young people especially, those under 65, many were not a candidate for either. So now, for discogenic back pain, there is another option. There's disc replacement, and with over 20 years of research and high level of evidence, I'm very encouraged seeing young people get back to their normal life with pain much improved or gone, usually gone.
And actually, the question that a lot of patients they might hear will be, why a fusion versus a disc replacement? Why one or the other one? Since for many years, or traditionally, spinal fusion coming from the front approach, lateral approach, back approach. Why that one? Why not the fusion versus a disc replacement? That's a lot of patients. They might ask you that question. So what will be a reasonable explanation for those patients to hear for deciding a fusion versus a disc replacement? Or there's something in the morphology that might decide I need to do this versus this one?
Absolutely. So the main reason to choose disc replacement is to lower the chances that another level will deteriorate. And historically, this quote-unquote urban legend that once you start with spine surgery, you never end, this was based on reality. If you immobilize the human spine with screws and rods, you do ask for the next free level to see more motion. And then with time, depending on the type of surgery or type of fusion, many of these patients end up having to go back to the operating room to have that additional level corrected, sometimes even twice. And this is spine surgery, so every time there's recovery, there's pain. So obviously it's not something that anyone would want. But disc replacement has been shown definitively to not cause this additional stress, and thereby to lower the chances of a young patient having to go back to surgery. So who is a good candidate? A young person with no deformity and minimal arthritis. Who is not a candidate? Someone with deformity. So if there is a change like scoliosis, for example, the mechanics are off and the disc replacement just won't work. In the end, you can put in a motion preserving device, but if the patient continues to suffer, it's not worth it, right? Because the goal is really pain relief. So for those patients, a well-executed fusion may be a absolute game changer.
And one of the things over here is that traditionally we hear patients having discogenic pain or pain coming up from the disc. And here, at least in South Florida, normally traditionally the spine fusion is the number one way of trying to correct this type of deformity or this type of problem. So in your experience, why not a lot of this type of surgeons or someone like you are offering disc replacements? Is it something related to insurance, or is it more about surgical techniques, or is it just more of a comfort level, or something that you have traditionally have done for many years, and this is the way that you have been practicing, and you want to stay with the fusion itself?
It's hard for me to say why. Insurance covers disc replacement in patients who are indicated for the above. South Florida market is a bit unusual, but I think you will see a lot of younger surgeons who are just coming out of training doing things very differently. Disc replacement is no longer something new. Because of all these years of research and testing, this is now a well-established technique. So I think it's encouraging to see that research and experience is going to change the way we practice. Every year we are going to see improvement in the direction of better surgery with less morbidity and earlier return to normal function.
About keeping with this, what would be like an expected recovery? Because I'm sure a lot of patients would like to hear about that they might be interested, and they have gone someone and they're looking for fusion and they just want to hear for second opinions. So how about like a recovery for this replacement? How long it will take? How long they have to use a brace, or refraining them from doing certain activities like exercising, physical therapy, etc.?
Great question, Dr. Mena. So recovery is surprising. If a patient comes in with objective pain coming from the bottom disc, for example, with back pain and sciatica, when they wake up from surgery, their pain is gone. They have some pain from the incision, and they have this different back pain that lasts a few days that's associated from an increase in their height. You see, disc replacement actually restores patient's normal height, and when they wake up, they actually are a little bit taller. So you pay for that with a few days of back pain. Once that's resolved, they go back to normal life, and they forget about the pain they had before surgery. There are no restrictions or precautions. There's no requirement for therapy. Usually these patients go back to their normal life within 2 to 3 weeks. And it's really encouraging because a lot of these patients have been suffering truly for years. And it's just really encouraging to see a patient wake up and say, "Doc, I have not felt this good in years." There's really just nothing like that.
All right. Actually, those are very good things to know. I hope that the audience here, they find this useful as well. Thank you and stay safe.
Thank you, Dr. Mena.